Dr. Sneed, now I have to go back to the whole situation where people are still hesitant about getting any vaccine. Some people saying that these pharmaceutical companies, they're just out for money. And especially when it comes to saying you need two shots rather than one and then possibly a third. How do you address those issues of people concerned about they don't want to get the vaccine, they're concerned about this being forced upon them, and particularly knowing that these companies are making so much money?
Well, the very first thing I'll share with many people here in our community and all across the entire state of Florida is that we have an enormous amount of oversight beyond, it goes well beyond the pharmaceutical company. Immediately, when we heard anything about Pfizer, we heard a very quick pushback from representatives from the FDA, the CDC, and Dr. Fauci and others with the White House. We're not going to listen directly to the pharmaceutical company. We're going to listen to the science and independent review of people, of scientists that know exactly what they're looking for, what they're talking about. And ultimately, we're going to look at hardcore data to support whether or not we need a booster. Now, I don't even like the term booster because I do believe that we have ongoing clinical trials right now that would be more of an update to the current vaccines. And that would be what we would call more genetically aligned with where the current the current viruses are. So we just have to be a
That's
little bit
getting
patient. But
fancy,
we are
Dr.
not going to be,
Sneed.
pardon me?
That's fancy terminology. The rest of us are just like booster. But
Yeah,
I hear what you're saying.
yeah, booster to me is not the right word at this current time. The only reason we would get a booster is if we can determine that people have waning antibody levels, or if you're immunocompromised or the elderly. At this current time, we have no evidence to support that, and so we're not going to be driven by a pharmaceutical company to make a decision based upon their data versus what is submitted and reviewed by the FDA.
Well, let me ask you this one too, Dr. Sneed. Here's another one. Say you have COVID and you're in the hospital and you're already sick. Can they not give you the vaccine then, or is it too late?
Well, in the midst of being ill with COVID, especially in the hospital, it is too late. At that current moment, we are in supportive measures. You're probably getting a dose of remdesivir. You're probably getting steroids. You may get the monoclonal antibody. What is not going to help you at that moment is actually getting vaccinated at that current time. And we're hearing that report continue to happen all over the country that people who are about to be intubated are asking for the vaccine at that time, thinking it will save them. It will not. We need about a month and really about a 5-week period for the full antibodies to really kick in and protect you from against the SARS-CoV-2 virus. And so, again, if you're hospitalized, probably too late, but immediately upon being released or when you recover, if you have not been hospitalized, we are encouraging people to go and get vaccinated. It will offer a more
Even if
broad
you've had it.
protection for you.
Right, right. Okay, so one more question here for you. I'm trying to give you another tough one because you seem to have a lot of these answers here. People still concerned about these different vaccines and what's in them. Let's go back to this mRNA. People saying that it hasn't been tested in humans. Where has this been tested in humans? What is it used in?
Well, I can tell you right now, it's one of the number one things I have to address all the time. I want to be very clear with all of our viewers. Messenger RNA technology has been around for over 20 years now. It emanated and started during cancer research. And really bright scientists said, hey, we can use it to develop vaccines. And vaccine development has been occurring for well over a 15-year period with messenger RNA technology. It is not brand new. It has been tested for years, starting back into the early 2010s. But right now, we have the pandemic has offered the first
But is it
opportunity
used in people
for
right now?
widespread use.
Is it
But
is it
messenger
used
RNA,
in people?
messenger RNA. You mean
The
are you referring to
mRNA,
messenger
the
RNA?
one that's in the Pfizer, the one that's in the mRNA, the one that's in the Pfizer and the Moderna, because that's different than what's in the Johnson and Johnson. Because that's what people say. Oh, that stuff
Absolutely,
hasn't been used in human
absolutely.
beings.
Yeah, messenger RNA technology has been around. It's the first time we have commercially used it at this level. It is not the first vaccine. As a matter of fact, Moderna had a very, very effective Zika vaccine. but Zika went away before it had a chance to come onto the market. It was about 97% effective against the Zika virus. And so people remember that happening and how far back that was. And that was messenger RNA technology. So no, it's not brand new. And you know what?
Why
People,
don't
we
they
should
tell
want
people
the latest
that?
technology. Well, I'm not sure. Well, that's why I'm here talking with you. They haven't had a reporter like you to come out and really ask that particular question to give people like me an opportunity to just share that this is not brand new at all. We need people to go out and get vaccinated. We have never had a safer vaccine development than we've had with messenger RNA technology. And so far, after over 400 million doses given, we now have overwhelming evidence of the safety. There may be a few very, very small number of people that have very mild adverse effects, but overall, there's nothing more dangerous than the Delta variant right now. I have to keep telling people that. The Delta variant, if you are not vaccinated, it will find you. And Laverne, give me 10 more seconds about breakthrough. You keep hearing about breakthrough, but you know what? These people are not becoming ill. What you probably will have is a very mild cold that likely will not produce the long COVID effects if you are vaccinated. So there's a big difference between being infected and finding the virus in your nose as opposed to having disease and winding up in the hospital or even dying. So we have to make a big distinction between being infected and finding it and then being diseased, which is COVID, and actually wind up becoming very ill, being hospitalized, having organ damage, or even death.
Well, I'm so glad you clarified all of that, Dr. Sneed. And like I said, you really have been able to share with us a lot more insights than you hear, on a regular basis. And like I said, a lot of people concerned. The bottom line is they say, what is being put in my body, right? Which is acceptable for people to wonder. And the fact that people were calling it new technology, but you are clarifying not new technology used in Zika vaccines.
Very
Again,
quick statement.
messaging it.
Messenger RNA is running through our body right now. It is part of the natural biochemical makeup of who we are as human beings. And so we have just learned how to harness the bioengineering in our body and ask our body to build a protective army of antibodies against a terrible virus. End of story. Nothing new.
Thank you so much for that biology lesson. I appreciate it. It was so helpful. I really do appreciate you being so patient with us. Take care. And stay with us ahead. We have much more news coming up. You're watching BNC Live.